All right. You ready?
Yes.
Okay.
Now, where am I supposed to look there?
Yeah, we'll just talk.
Okay.
It'll just be fun. Okay. Hi, hey, everybody. It's been really great just getting to know you. So I'm just going to ask you a few questions, okay? And just kind of experience what your experience has been. So, how was affecting your life?
Sure. I was in pretty bad shape when I decided to come here. I actually was up at 2 o'clock in the morning in pretty severe pain with both of my hips. I was having sciatica. About 21 years ago, I had a ruptured disc in my neck from a workout injury. And so I had that operated on, and I did okay for a long time, but then I started to notice that I was having numbness in my arms again, like I had, when it first happened. But the really bad problem was my hips were just really, really sore. I was having a lot of sciatica. I drive in the car a lot. I have a 4-hour drive to one of my jobs, and I would get out of the car and I would just be like stiff as a board. I couldn't sleep at night. I was unable to sleep on my side, which I normally love to do, and so I was just pretty miserable.
So how were you on your back, or?
Yeah, I mean, the only way I could get comfortable was to sleep on my back, and at that, I was never comfortable. I was just miserable. And so at 2 o'clock in the morning, I saw a Facebook ad for your office, and I filled out the little form, and the next day I had an appointment.
That's awesome. And that's why we love doing all these different ways of, I guess, externally getting out in the community, because I would have never imagined you would have come in from Facebook, so that's cool. But anyways, that's really cool. So you had this kind of place where you were at. You went to did the Facebook ad, and then from there, coming into the office, just kind of tell everyone your experience. What was what your experience?
Well, it was really, I felt comfortable from the first time that I came in. Lauren, the young lady who set the appointment up with me, she sat down with me and had me fill out some forms and just kind of talk about what kind of symptoms I had and what kind of goals I had. What did I want to accomplish? Which is totally different from when you go to a regular doctor. When I went to the doctor with my neck, he says, well, you got to have surgery. And that was the end of the discussion. So it was wonderful because I was nervous. Having had surgery on my neck, I had thought about chiropractic before. I had heard about it, and some friends, had raved about it. But I was like, well, I can't let anybody pull on my neck. There's no way. It'll break my neck. I really thought that.
So many patients come in like that actually after surgery. And there's so many people with surgery now, but they come in and they're like, don't touch this part. And although we can't do anything about that exact spot, everything else we can.
Well, right. and Dr. Holly actually did my assessment, and she just made me feel so at ease about everything. It's like the fear just went away. I was like, you know what, these people are going to help me, and I'm just going to trust them. Cool. And it really was cool because I remember when I stood on that machine that you have, I guess, that measures
weight distribution.
The weight distribution. Yeah. And Dr. Holly said, "Oh, honey." So I knew I was in pretty bad shape, and so I was like, well, so the assessment really helped me to understand what was happening with my spine. My work background, I'm not a clinician, but I have 35 years of experience in healthcare. So, I knew all the terminology, talking about, subluxation in your spine getting sort of pinched and rotated and all that stuff. But I had no idea that it was happening to me, like that. She goes, no, your hips are really, out of alignment.
So tell us, so you did that, great consult, great exam, did the x-rays, went through went through a process where you got educated, decided to start care, and then since you've been under care, what have you experienced?
I feel like I didn't realize how bad I felt until I started feeling better, if that makes sense. Yeah. After the first visit, I have not had any more sciatica. Maybe, like a twinge for one day out of the last, and I guess I started almost 3 months ago.
That's really cool. That means that not only do you get pressure off the sciatic nerve, but those nerves go to other areas of your body too. So that's huge. Okay.
Yeah, that was a big thing. And now, because I'm getting the adjustments, I can tell, like if I overdo it at work and climbing up and down ladders and things, I know that I can just come in and say, hey, this is how I'm feeling today, and you just work on the places that need working on, and having the decompression treatments, the traction on my neck.
Huge for your fingertips with the numbness.
Yeah, I haven't really, because I had severe nerve damage. Like this finger, when I ruptured the disc, it stood out straight like that, and it was just completely numb for the longest time. So
it's not numb anymore?
No.
That's awesome. Cool.
Yeah.
And then I think you mentioned, what's your sleep been like?
Oh,
That's the best.
Yeah, much better. Much better. I can sleep on my side when I want to, but I try to sleep on my back now to try to, keep the curve in my neck with the little, foam roll thing that you gave me.
Yeah.
But I don't worry about whether or not I'm going to be able to sleep. And, I'm not, I was so sore when I would get off work. I walked down a bunch of steps to get to my apartment, and I would have to just really hold tight to the rail and put both feet on each step. And I was like, this is what, people who are like 80 years old have to do. And now I can just, when I'm at the top of the stairs, I can just start down and walk, and I feel balanced, and it doesn't hurt. I mean, my knees aren't sore anymore. It's crazy how everything.
It's all connected, yeah.
Yeah.
And that's so big. So what that ultimately means, so 3 months of kind of going through chiropractic care and getting different changes, that means overall your health is better, your body's healing better. And then think about a year now from now, 2 years from now, 3 years from now, continuing to just get healthier and healthier. And that's the big picture. So that's cool.
Absolutely.
So let me ask you this question. So a lot of times people coming in, whether it's from Facebook, whether it's from the internet, whether it's from being referred in, there's a lot of skepticism still about chiropractic. So what would you say to that? Just coming from the medical world as well into chiropractic, what would you say?
I would say just trust the process. The human body is a miracle in itself, and I think there are a lot of misunderstandings about holistic healthcare, but it works.
Yeah.
I mean, it straight up works.
That's
and
cool.
And it just, and I love the education that you guys do every time. There's always videos playing on the TV about nutrition and how you can really make positive changes. So you feel like you're a part of your own health versus just going in and,
so you're your own doctor.
Yes, you're your own doctor.
That's
exactly.
What I teach. Cool.
Yeah.
Okay, cool. Well, thanks so much. I know that sometimes shooting videos isn't always easy, but you did really good. So.
Thank you.
All right, cool. All right, we're all set.
Okay.
Thanks, everyone.